Do you know that when your health is compromised, your skills, wealth, wisdom, and intelligence become ineffective? You're welcome to HealthAfrik, the health show that seeks to enlighten you on health issues with the help of an expert. And it is brought to you by the Association of African Universities. My name is Isabella Tete Ahenakwa. Still on creating awareness on bone diseases, we are here at the Kolebu Teaching Hospital to have a conversation on spinal stenosis. I know you wouldn't want to miss this episode. Stay tuned, we'll be right back. You're welcome back from the break. This is HealthAfrik, your favorite health show on television today. And as I stated earlier, today we are going to talk spinal stenosis, and we are here at the Kolebu Teaching Hospital. If you just tune in, you can follow this discussion on our social media handles at Association of African Universities on Facebook and YouTube, AETV_African Universities on Twitter, and AETV Official on Instagram. We are going to have this discussion with the help of Dr. Jerome Boatey. I would like you to tell us more about yourself and what you do.
The name you mentioned, Boatey Jerome. I trained as a neurosurgeon in Ghana and subspecialized in spine and pediatric neurosurgery in the US. So my general education is in neurosurgery, and then my subspecialization is in spine. And I do all sorts of spine diseases, surgical spine diseases. We do medical, but we really concentrate on the surgical part. And I do both adult and pediatric spine, including spinal deformities as well. Deformity is where you have the abnormal curvature of the spine, which can be caused by either you are born with it or you acquire it during your development. And then I also do pediatric neurosurgery, including pediatric brain and spine. So that's my areas of specialty.
Yeah. Okay, thank you very much, Doc. Today we are going to talk spinal stenosis. So kindly tell us what spinal stenosis is. I know it's a disease. The name itself, spinal, it means it's a disease on the spine. So apart from that, tell us more.
So let's get some definitions right.
Okay.
We say spinal column is the articulation of the spine. From the neck region or the base of the skull right down to the tailbone. Luckily we have a model here. So the spinal column is the whole articulation right from the base of the skull, which comprises the cervical region, a thoracic region, a lumbar region, a sacral region, and a coccygeal segment. General knowledge, we call this one a tailbone. But it's actually made out of the sacral and the coccygeal element, that's more tail here. The upper part articulates with the skull and holds your heads up. The middle part here articulates with the appendages or the ribs and the shoulder and holds the shoulder up. The lower part here is a weight-bearing segment. So you notice that as you go down, it gets bigger. So it carries all the weight column with it. And then in the sacral region, or the lower part, it articulates with the iliac bones and then joins the lower extremities. And then this is the one that transmits the weight into your feet. So the weight from the top is all carried along the spinal column. So this is the spinal column. And it comprises of the bone, the small bones which articulate with each other. Generally they are about the same shape, but it changes a little bit as you go along from the cervical to the lumbar due to the type of weight, the movement they produce. And one thing is important to understand that even though it's a bone, it's not a rigid bone. It articulates, and then the hole in each of the bone joins up to form a canal. And it is through that canal that the spinal cord, which transmits from your brain, runs through, and its content runs through. And it is the way the brain communicates with the rest of the body. So if you have to move your hand or your arm, information runs from your brain right through the spinal cord into your hand and tells your hand muscles to move, and moves. If you want to have any sensation or you feel something in your hand, it's actually, you feel the sensation which is detected by sensory organs in your skin and runs through nerves in your arms, go through your spinal cord into your brain, and then it's interpreted, and that you feel as pain or as touch or whatever type of sensation you feel. So the spinal column has a lot of functions. So it forms both as a mechanical to support the head and the frame, and also hold the content of the spinal cord and supports all this one, and allows movement at the same time. So the way it does this is that you notice that the bones are pieces and articulated on each other, and between the pieces are what we call the shock absorbers or the discs. And they help in allowing bending forwards, extension, rotation, movement, and at the same time protecting the spinal cord and its content. So what happens is that if we say spinal stenosis, basically the canal through which the spinal cord passes, and or the lateral hole where your nerves pass into your arms are narrowed. And when it narrows, that means it's pressing on another spinal cord or the nerve roots. When it does that, that means communication between the brain and the periphery is interrupted. It can happen basically as you are born with a very narrow canal, or you acquire the narrowing as you grow. The most common type we see is a degenerative, where as you grow it narrows. So as soon as you say spinal stenosis, everybody's talking about the one you develop as you grow. And there are a couple of disease states that does that. But I think let's keep to a general knowledge, otherwise we'll get you confused. So basically, if you are born with a very narrow canal, then there's a likely chance that as you grow, you have an earlier on narrowing because of the changes in the canal, and the discs as you grow. We'll get to that level soon, and I'll try to explain something to you. So as soon as you say spinal stenosis, most common region is the neck region and your lower back, because that's where most of the movement happens. Your thoracic region, there are a lot of ribs there, they prevent your thoracic spine from moving too much. So most of the narrowing occur in the cervical and the lumbar region. I'll focus on the most common one, which is the degenerative, but then we can talk about the other ones as well. So in general, as soon as you say spinal stenosis, you mean narrowing the spinal canal and or nerve roots in the cervical region, in the thoracic region, but can occur anywhere along. And it is a degenerative. Degenerative means wear and tear. So what happens is that as you grow, the disc or the shock absorber between the two wears out. And as it wears out, it flattens out. And then there are small ligaments which holds the bones together at each level, inside the canal and outside. The outside ones are of not much relevance to us. But the inside one, when they wear down or degenerate, they thicken up. So just imagine from the front, the canal is being pushed out by the disc which flattens out. And then the ligaments inside which also toughens and thickens also starts to. So you have both narrowing from the front and narrowing from the back. And then they narrow the canal. And the same principle happens in all the canal. So that's why we call it spinal stenosis. Let's look at the population. Basically, about 40% of the population at one time develops back pain.
40%?
Yes, it's a big population. They have back pain. But to say spinal stenosis, you really need to examine the patient and know that this is spinal stenosis and not some other disease state that resembles spinal stenosis. So most of them will present with back pain, either in the neck region or the lower back. And the back pain can be just an ache restricted to the neck region or restricted to the back, or if it's present on the nerve root, then it flows along the distribution of the nerve root. So you have back pain in your neck that flows into your arm, and may or may not cause weakness and or paralysis on the severe form. If it is the central portion, then it will press on the spinal cord itself, and that means function below that level is lost gradually as you grow. It's seen. We usually start to see it around age 40 onwards, 45 onwards. In very few people, you can see it around 35, but in general, it's usually around 45 onwards. The majority of people, you see them around 50, 51, 52. And then as you grow, 60 years, about a third to two-thirds, a third to half of the population develops some degree. But you may see a very elderly person with a very nice spine, with no stenosis.
With no stenosis?
Yes. And that's your genes.
Okay.
Yeah. So even though we say wear and tear, some people are born with good genes. And if I say good genes, it doesn't mean your genes are bad. But basically, some people are born with genes that for which they develop less wear and tear as compared to others.
All right.
But the basic symptoms are pain and discomfort.
Okay.
So if it happens in your neck, usually it's pain in your neck, numbness in your hands, and functions below that level. And it could be your urine control that's affected, for which you can't control and hold your urine. You have to rush to the bathroom. And those are in the severe cases. Or your bowel control, where you have a lot of constipation, you can't control your bowels. And then you have to, anytime you feel like going to the toilet, if you don't hurry up, it will just fall out. That's bowel bladder control. And then in your legs, you notice that you walk for a few distances. When it happens in both your neck and your lower back, you walk a short distance, and then the back pain gets worse. And sometimes you have heaviness in your legs, and you may have numbness in your legs as well. And the severe form is such that you walk a short distance and then you feel like falling because your legs feel heavy and unbalanced. These are all functions of the spinal cord, and because there's a disruption in them, you feel like falling. So some people, they walk for a while and they fall.
They fall.
So their gait is disrupted. These are the most common functions that are disrupted in spinal stenosis. But basically it's pain, and it starts insidiously. So this is not the one that starts suddenly. This one starts gradually. I say, my backache is getting worse. And then now you say pain is now getting into your arms or getting into your legs. And then you start having this urine or bowel and bladder control issues. You need to see your doctor. And then your doctor will evaluate you, and if he thinks that you have a spinal problem, and then they will refer you to the specialist, who will then evaluate you for further diagnosis. But in the beginning, Management of this, usually painkillers helps, and physical therapy. You need to be active. Just like you have, you sit down, you don't do anything, you have develop pain in your joints. You can also develop pain in your back if you are not active. So you need to be active, and it helps in managing some of this pain from the beginning. So it's not every back pain that needs surgery or painkillers.
So we'll come to the treatment.
Yes.
So before we go to the treatment, I'd like to ask other types of spinal stenosis, and what are these types?
Okay, so because we don't want to mix the diagnosis of spinal stenosis, the degenerative form that comes with aging, with other types of spinal narrowing. So usually when you ask us, we say this is a narrowing which is caused by, if you have an injury to the spinal column, you can narrow your spinal canal. We don't call it spinal stenosis. But it's the stenosis of a type.
Okay.
If you have the disc between the vertebral bodies, they can rupture and then move into the canal and cause narrowing. We generally don't describe those ones as spinal stenosis. You have to describe exactly what is happening. He has a ruptured disc or herniated disc. But if you say spinal stenosis, it's really typical concentric narrowing of the canal.
Okay.
With the aging, so that you don't mix them up.
All right.
That's the main reason. Okay. And as I said, you can be born with a very narrow canal, and then you present earlier with narrowing. That's what I can say. But the other disease conditions that can present with narrowing of the spinal canal with aging. An example is hypertrophy of the anterior longitudinal ligaments. So the ligaments, so there are some people who are born and develop a disease state where the ligaments are in the canal, which holds the canal, they get thickened.
Okay.
Not like the general concentric, just thickened and in front like that. And they keep on pressing on the spinal canal. And it happens mostly at around age 40 onwards.
It coincides.
No, this one you as you grow it develops, and it becomes thickened, and then forms bone, hard bone, and narrows the canal. So that's one example of a disease condition that can cause spinal stenosis. There are also some other disease conditions that form extra bone in the canal. And then disease conditions that cause collapse of the bone, expansion and narrowing the canal. Tumors can do that. Infections can also narrow your canal because the collection of the abscess can form in the canal and narrow the canal. But we don't describe them as spinal stenosis. To differentiate them, because those are emergencies you need to sort out.
Right.
So they get confused. Because if you say that, the reason I'm bringing it up is that all these things can cause back pain. And if you don't diagnose it well, and somebody has maybe tuberculosis of the spine and cause collapse of the bone, compressing the spine, and you don't go and treat it individually, you may treat it as if you are treating a normal spinal stenosis, and the outcome will be very bad. It results in, perhaps may result in paralysis. So that's the difference between the other forms of spinal stenosis and this one.
Okay, coming to the causes, you made mention that you can be born with it or you can develop it. So what actually causes it?
So
maybe daily activities that we do.
Oh, just like we have, some people are born with big heads, some people are born with small heads. Some people are born with abnormal bone, and the bone can involve the spinal and then narrow the canal. There are so many forms of it. I don't think we want to go into that detail now, but yes, those are called congenital spinal stenosis. Congenital means you are born with it. It happens in a group of people, especially short people with what medically we call dwarfism. Yes. Some of them do are born with congenital stenosis.
Now, aside being born, what can cause the spinal stenosis?
Age-related. And as I said earlier, as you grow, the discs flattens out, wears out and flattens out. The ligaments in the spinal canal thickens, and they all cause narrowing in the canal.
And how about weight?
Weight gain?
Yeah.
No. Weight gain wears the spinal column earlier. So if you are about 35 and you have excess weight, you present earlier than somebody who is light-weighted. But to say the weight gain is the one that is causing it, it contributes to it. Yes. And we've also noticed that if you reduce weight, the pain in your back comes down. So one way to treat the disease of spinal stenosis early on with the pain is to reduce weight.
Okay. All right. And then how about sitting gestures, or maybe we carry heavy things? Can this also cause spinal stenosis?
It causes back pain.
Okay.
And worsens spinal stenosis. So basically, if you don't sit well, so you don't sit crouched forwards or arched back in the neutral position, that's what we recommend.
Okay.
Because if you sit crouched forwards, you strain your spine, and if you have the early onset or any disease in your spine that causes pain, it worsens your back pain. So yes, it worsens the back pain, but to say it causes spinal stenosis, no.
Okay.
I wouldn't push it that far. But yes, if you have some degree of spinal stenosis or you have some degenerative change in your spine, yes, it will worsen your back pain.
Your back pain.
And then if you correct those things, it helps with your back pain.
Okay. My next question is, who gets spinal stenosis? You made mention that at the age of 45.
Yes, onwards. Everybody is at risk.
Everybody, yes. Male or female.
It doesn't matter.
How about children?
No, it doesn't happen in children because it's age related. So as you grow, the disc wears and flattens out, as I said.
Okay.
And then the ligaments also wear and thickens.
Okay.
So it's age. So by the time you get, your spine was not meant to live forever. So as you grow, these things happen. So in young people, this is not a young people disease. It's an adult population disease.
Okay. Now moving on to the symptoms, you said you feel pain or maybe numbness in the hand. Aside that, what other symptoms can you get when you develop spinal stenosis?
So the early on is back pain.
Okay.
It could be in your upper back, middle back, or lower back. Most common is upper and lower back. Well, that's where most of the movement. I know people also describe it as a wear and tear disease. So as you grow, the degenerative changes and a wear and tear develops that. So pain and sometimes discomfort. In our local parlance, it works as a Madame Conso. You know, it hurts. And then sometimes you move your neck and you have pain. So you need to evolve and reevaluate and be sure that it is the degeneration or the stenosis that's causing your neck pain. And the pain then may move into your arms with the tingling, numbness, and or weakness. And then any function the nerve does, maybe it's ruptured. So you're walking, your urine control, your bowel control, that's your toilet control, and your balance. Those are the main things that are affected, and it's in severity. If it starts early, there's a good chance that you can reverse it. So if you intervene early, there's a good chance that you can resolve it. But if you wait too long and there is permanent damage to the spinal column, and there's a very good chance that you may stop it from progression, but you cannot reverse the damage. What you have is what you have.
Right. Earlier on, you made mention that some diseases can be confused as spinal stenosis. I'm interested in that. I want to know those diseases that can be confused with it. Just mention.
Okay. So a disease like infection in the spine
Okay.
with compression of the spinal cord also produce weakness in the legs, like spinal tuberculosis. It's similar tuberculosis, a different form that forms in the lungs can also affect the different organisms. The same organism can also do that, affect the spine, or any infection in the spine can resemble spinal stenosis because it also gives you back pain. Injury to the spine can also do that. Abnormal posture for a long time can give you back pain and may resemble spinal stenosis. Tumors that are growing in the spine on the early onset, yes, may resemble spinal stenosis because they also cause compression and instability of the spine.
All right. Before we end this first segment, I would like to ask, can spinal stenosis cause paralysis?
Yes, in a severe form,
In
yes.
a severe form.
It's called paralysis, and it can be wheelchair bound.
Wow.
In a severe form, yes. So the beginning, usually no, but then it's a warning sign that you need to deal with it before you move on to
that stage. All right, thank you very much, Doctor. This is the end of the first segment where we talked on the introduction of spinal stenosis. Stay tuned.